Hey guys, give me some love, tap some hearts if you can hear me because I'm not sure if this is working right. It's a little past 5, so we're going to go ahead and get started. Just to let you know, I am Dr. Tolentino. This is going to be every Wednesday, pretty much wellness topics, some things that really interest me. I am an EliteHealth physician here in Miami Beach, and our practice is dedicated to prevention and wellness. Most importantly, if you guys have any questions about the topics that I discuss, make sure that you talk to your doctors about it, or you visit in a facility like ours, like EliteHealth. That would be great. That way you can understand more about what's going on with your body. Number one, my background is basically in family medicine and also board certified in family medicine, and after that I did training and certification in bioidentical hormones. My main purpose for doing that was so that I can understand the connection between hormones in the body and also be able to educate you guys as well as my patients here at the office about what's important as you go further along in your lives. My main definition for the term wellness is basically you trying to understand how you can keep yourself well or healthy at any age and what you can do proactively to help yourself. So for this first one, I wanted to talk about how there's different levels. For example, wellness I think of on different levels of the ability to understand it so that you can kind of guide yourself in how you're going to take care of yourself. For example, the most basic things that you can do from anyone can do these things would be, I have 5 of them. One of which is exercise. Exercise is going to be hugely important in everyone's lives. It's also very important for you to exercise the right way and understand why you're exercising and how it's affecting you. For example, not every type of exercise is important for each person. Some things should be focused on more than others, and exercise does encompass so many different types. So it's really important for you to pay attention to the types of exercises that you're doing and whether or not they're good for your body. And those are things that you can discuss with your doctors, with dietitians even, with the sports medicine trainers, with your personal trainers at home, and people that pretty much learn more and understand how exercise affects the body. The second thing that is one of the most essential tools to wellness is probably water. Exercise is probably first on my list to keeping yourself healthy and well. The second is water. I am one of those people. I definitely don't drink enough water. I wish that I drank more. Sometimes when you are just pretty much going about your day, you forget how important it is, but it's really crucial to your body. So for most people, when they say 8 to 10 glasses a day, that's an average, and that's really 8 to 10 glasses or cups. But most importantly, it's important for you to understand that if you are exercising more, if you're overexerting yourself more, you're going to be needing more water. So 8 to 10 glasses may not cut it, and of course for some people they'll require more of that, especially if they're exercising more. One thing that I noticed on the latest dietary guideline recommendation was sugar. Sugar was very, very huge as far as one of the topics. If you Google the 2015 dietary guidelines that were just released now in 2016 as a final, it did mention how important it is for everyone to keep their sugars down. I think they said they wanted less than 10% of your body, 10% of your intake rather, to be sugar or less. So 10% would be, very minuscule compared to what you're eating on a daily basis. I personally took a next step in January, and I signed up for something called myfooddiary.com because they did a 7-day free trial. It wasn't important for me to check it on an everyday basis over the course of a month, but it was free. So it was free for a good 7 days, and that's really all I needed in order for me to target how I'm eating and what I'm doing and what I need to be doing differently. It doesn't have a spot in there for water, so I do use an app to kind of help me make sure that on a daily basis, couple 2 to 3 hours throughout the day, that I am getting enough water intake, and on the days that I exercise or work out, that I'm getting more. But it does do a good job of making you aware of everything that you're eating and how much your sugar content is. It'll break down your proteins, carbs, sugars, your calories, everything that you really need to pay attention to so that you can kind of focus in on that aspect of your wellness. The next thing on my list would be mindfulness. Mindfulness has become huge. For some reason, people are really looking towards that and focusing in on how important it is, whether it's in a spirituality type aspect or you're actually just, finding time for yourself to read, meditation, some sort of yoga, those types of things. And those are just a couple examples of things you can do. Those are really things that I think are very important. Deepak Chopra, he did something on the news recently where he did mention how important it is for people to really pay attention to themselves and actually look into their inner spirit. Mindfulness is definitely one of the top 5 basic essentials to wellness, so that's my 4th one. The last one I think would be important is sleep. Sleep is huge. If you are not getting enough sleep or the right kind of sleep, you will not be able to function on the most important level. Every single day, they say an average anywhere from 6 to 8 hours, depending on how much your body needs. And there's not really an exact number. The most important thing is that you're actually restoring your body. And as far as sleep goes, if you are sleeping 7 hours and you're waking up feeling well rested, that's what's important. So at the time that you wake up, your cortisol levels have actually restored themselves from the day, as well as the rest of your tissues in your body. And by the time you wake up, you're full of energy, ready to go about the day. So that's 100% important. So to top off my top 5, it's definitely exercise, the right type of exercise for you. Getting enough water, depending on if you're exercising throughout that day, you may need more of it. Decreasing your sugars, for sure, 100%. Everybody needs to at least be aware of this. And if you need something like I did to really pay attention to how much you're actually using, you should use something like that. They do have a lot of free food diaries online just for you to kind of get a better idea as to how much you're actually eating. Number 4, mindfulness. Find some way to actually rest your brain, for you to actually sit down and get some time for yourself. And then finally, sleep. In my following podcast, it's important for you guys to know that as far as my hormone training, I do focus a lot on optimizing hormones and making people feel their best as far as how their symptoms are. So I am a certified physician in bioidentical hormones. I do take that into consideration whenever we see patients here in the office. All of my patients that come for their annual visits, we do actually break down all of the hormones. We look into and see what exactly is going on. As you know, both women and men, as you get older, a lot of your hormones decrease. And along with that comes with a lot of symptoms. This happens sooner for some people. For other people, it does happen a lot later. But, as you go through life, you will pay attention to yourself. You'll pay attention to your body and understand what's most important. And you will actually see that sometimes, actually I'd say not sometimes, probably 90% of the time there's a hormonal component there that needs to be addressed. So make sure that you kind of pay attention to that for yourself and think about it. There's other aspects of wellness that are not quite on this basic essential level that we will discuss as we continue on with these podcasts. One of which, for example, things that we do practice here in the office is to make sure that we look at things on a deeper level. One of which I mentioned, for example, the exercise, and how you should be exercising for your body, how your body is handling that stress. We also take care of patients for fitness, wellness, combine the two together. Some people are really just focusing on what their exercise, but then they realize that everything else does need to be looked at. As far as optimizing hormones, it's not even about prescribing medications. It's about understanding what's happening to you as you get older and what you can do to help yourself with that. So let's start with these 5 basics here, and then we'll take it further, okay? This was step number 1. And make one last thing. You should make sure that these things turn into habits. All 5 of them really do need to turn into habits. So on a daily basis, you need to start being mindful of all 5 of these things. If you need something to help you do that, whether it's downloading an app or finding something on the computer or listening to something, make sure you pay attention to that. I am doing a lecture in the office. This one's on inflammation, inflammatory foods. And this will happen next Wednesday, so if you guys are in the area, make sure that you check that out. Inflammation for me was a big part of my life, so I definitely want to share that with you. I'll share some tips and some things that I learned. Also, it's important I give my patients something like this to kind of go over a few things about protein, fats, and carbohydrates, and actually what causes inflammation and what they should be doing. So our dietitians are very good about counseling our patients with this as well. Last thing, there's a superfood list. If you guys are interested, make sure you can email me. My email is jt@elitehealth.com. I've got one of these. I'm going to start one on inflammation as well. It's from the aspect of inflammation. It's important for you guys to know that inflammation is a good thing in some circumstances. In other circumstances, it's not a good thing. And food-wise, some of us have chronic inflammation where over time it's just developed. And it's developed to the point where it's really affecting your body and how you function on an everyday basis. So that's something that I'm going to address next time. Thanks for the love. I will see you guys next Wednesday at 5 o'clock.